Assalamu alaikum. This is Dr. Shumaila, Assistant Professor of Community Medicine. Today we will be discussing the epidemiology of non-communicable diseases. As you all know that the diseases in nature are broadly categorized into two categories, the communicable diseases and the non-communicable diseases. Communicable diseases are those which spread through bacteria, virus, fungi, helminths, etc. They include diseases such as tuberculosis, dengue, malaria, measles, mumps, and the list goes on. Similarly, non-communicable diseases, these are the diseases such as cardiovascular disease, cancer, chronic respiratory disease, diabetes, renal diseases, mental diseases, injuries, etc. So today we will be discussing the epidemiology of non-communicable disease. By the end of this session, the participants would be able to define the non-communicable diseases of public health importance, discuss the epidemiology of non-communicable diseases, and identify and discuss public health interventions and approaches to control and prevent non-communicable diseases. A non-communicable disease is a disease that is not transmissible directly from one person to another. As you know, communicable diseases, they can spread from one person to another, such as COVID-19, flu, tuberculosis. They can spread from one person to another, but the non-communicable diseases, they do not. These diseases have genetic, lifestyle or environmental causes rather than viral or bacterial. So we can say that the non-communicable diseases are basically, they are the health conditions that are not caused by acute infection. Rather, they result in long-term health issues. Sometimes the non-communicable disease persists for years and in some cases for lifetime. Also, these diseases require long-term treatment and care such as lifestyle changes or medication. There are a lot of non-communicable diseases, but the most common worldwide are cardiovascular diseases, cancer, chronic respiratory disease, diabetes and stroke. In order to understand a disease, it is very important to know its natural history. If we know the natural history of the disease, then it becomes easy for us to develop the preventive and curative measures against the disease. Unfortunately, for the non-communicable diseases, there are many gaps in the natural history. So we will discuss them one by one. First of all, there is absence of a known agent. As we know, in communicable diseases, usually there is one single agent associated with the outcome. For example, COVID-19 is caused by coronavirus. Flu is caused by influenza virus. Chickenpox is caused by varicella zoster virus. So one cause is associated with one outcome. But in non-communicable diseases, usually there are a number of factors which work together to produce the disease. So there is absence of a usually there is absence of a known agent. Further, there is multifactorial causation, that is, one disease is caused by multiple factors. As you can see in this picture, in this figure, the diseases which is mentioned in the figure is heart disease. Now you can see that the heart disease is associated with a number of factors such as smoking, cholesterol, hardening of the arteries, hypertension. So, single agent is not involved, rather a number of agents are working together, and again these factors, they are due to some other factors. For example, smoking is due to stress, and stress not only affects the smoking, it also affects the hormones and the diet of the individual, and diet is associated with the physical activity and obesity. So here you can see in the figure that there is a web of causation, that is, one factor is interlinked with many other factors in many ways, and ultimately working together they produce the heart disease. So because of the complex interaction of the factors, it is difficult to control the non-communicable disease. Further, they have long latent period. Long latent period is just like the latent period of non-communicable diseases is just like the incubation period of the communicable diseases. That is, it is a period between the first exposure to suspected cause and the eventual development of the disease. For example, in case of cervical cancer, the period between the exposure to human papilloma virus and the development of the cervical cancer, the period is called the latent period. So in non-communicable diseases, this latent period is very long. So this makes it difficult to link suspected causes with outcomes. And then come the indefinite onset. Usually for the non-communicable disease, we do not know when they started, because this most of the time they start early in life or very long ago before the actual manifestation of the symptoms. So because of these gaps in the natural history of non-communicable diseases, it is difficult for us to control these diseases. Now coming to the epidemiology of the non-communicable diseases, these diseases are more prevalent and more common than the communicable disease, and the mortality caused by the non-communicable diseases are also more than those caused by the communicable diseases. According to the data from WHO, non-communicable diseases kill 41 million people each year. That is equivalent to 74% of all the deaths globally. See, here you can see that uh, almost three-fourths of the global deaths are caused by the non-communicable diseases. Each year, 17 million people die from NCD before the age of 70. So usually the average age of the human being is 70. So 17 million people die before the age of 70. And out of these people, 86% of these premature deaths occur in low and middle income countries. Means the deaths due to NCDs are more common in the lower and middle income countries. Of all the NCD deaths, 77% occur in low and middle income countries. Cardiovascular diseases account for most of the NCD deaths. So the most fatal disease, non-communicable disease is the cardiovascular diseases, because it is responsible for the majority of the mortalities. So it results in almost 17.9 million deaths annually, followed by cancer, which causes 9.3 million deaths. Then comes chronic respiratory diseases, that causes 4.1 million deaths, and then comes diabetes, which causes 2 million deaths, including kidney disease deaths caused by diabetes. Among all the NCDs, the four most common are the cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, and they are responsible for over 80% of all premature NCD deaths. There are multiple risk factors which are involved in the causation of the non-communicable diseases. Out of these, the four most common are tobacco use, physical inactivity, the harmful use of alcohol, and the unhealthy diet. So all of these risk factors, they increase the risk of dying from an NCD. Detection, screening, and treatment of NCDs as well as palliative care are the key components of the response to NCD. Now, the four most common NCDs are caused by four risk factors which are very common to all of them. These four diseases are cardiovascular, diabetes, cancer, and chronic respiratory disease. And the four common risk factors to them are tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. Here you can see in the chart that tobacco use is associated with all the four NCDs. Similarly, unhealthy diets, physical inactivity, and harmful use of alcohol. These three risk factors are associated with cardiovascular diseases, diabetes, and cancer. So, this is also known as 4 into 4 agenda. That is the 4 diseases associated with 4 modifiable risk factors. Nowadays, another disease is added to it, that is the mental health. So, mental health is considered as the fifth disease, which is non-communicable in nature. And another risk factor is added to the list of the modifiable shared risk factor. That risk factor is air pollution. So air pollution is the fifth risk factor that is associated with the cardiovascular disease, diabetes, cancer, chronic respiratory disease, and mental health. As we know that the non-communicable diseases are more prevalent in the upper income countries, and the non-communicable diseases are more prevalent in the lower income countries. Unfortunately, Pakistan is facing the double burden of disease. That is, it is having both the communicable and non-communicable diseases. In Pakistan, non-communicable diseases are among the top 10 causes of morbidity and mortality. Now look at these statistics. This data is from 2017. Here you can see that the communicable diseases and the maternal, neonatal and child health, it accounts for 31.5% of the total deaths. That is more than 446,000 deaths. And if you look at the non-communicable disease, you can see that non-communicable disease account for 60.3% of the total deaths, almost double of that which is caused by the communicable disease and the mother and child health. Similarly, injuries, they account for almost 8.16% of the total deaths. Then you can see further that the cardiovascular diseases in Pakistan, they contributed to 26.9% of total deaths. Cancers contributed to 12% of total death. Diabetes and chronic kidney disease contributed to 5.5% of total death. Digestive diseases contributed to 5.1% of total death. Chronic respiratory diseases contributed to 4.9% of the death, and neurological diseases contributed to 2.3% of the total deaths in Pakistan during 2017. Now so far we have discussed the common and non-communicable diseases, which are the cardiovascular disease, cancer, respiratory diseases and the diabetes. So we discussed that there are 4 risk factors which are very common and they are associated with these 4 diseases. These 4 risk factors are tobacco use, harmful use of alcohol, unhealthy diet and the physical inactivity. Fortunately, all of these 4 risk factors are modifiable. So we can practice certain intervention to modify these risk factors so that we can bring a decrease in the non-communicable diseases. Out of these risk factors, one of them is tobacco use. As you know that tobacco use is very common all over the world. However, in developing country, its use is now decreasing. But unfortunately, in Pakistan, its use is increasing. So the WHO has introduced certain interventions and certain campaigns to decrease the use of tobacco. These are, number one is tax increases. By increasing the tax on tobacco, its price increases, and when the price increases, the purchasing power decreases. So in order to decrease its availability or to decrease its use, so tax are posed on its sale. Further, there are policies which say that the tobacco is not allowed in indoor workplaces and in public places. Also in Pakistan, there are such policies that cigarette smoking is not allowed in the indoor places and in public places. Further, we can also reduce the use of tobacco among public by educating them against the harmful effects and the consequences of the tobacco use. Further, the government, it can what it can do to decrease the use of tobacco by putting bans on its advertisement, promotions and sponsorship. In this way, tobacco use can be decreased. Then comes the harmful use of alcohol. Similarly, like tobacco, if we increase the tax on alcohol, then its price will increase and ultimately the purchasing power of the consumer will decrease. As the purchasing power will decrease, definitely its use is also going to get decreased. Further, there should be restricted access to retail alcohol and there should be bans on the alcohol advertisement, because you know advertisements attract a lot of people and they can our general public generally adopt a lot of things by watching the advertisements. So if we restrict the advertisement, then this is one way of preventing its access to the general population. Then comes the unhealthy diet and physical inactivity. You know that the intake of salt and trans fatty acid is associated with cardiovascular diseases, cancers and diabetes. So we need to reduce the salt intake in food. Also, we can replace the trans fatty acid with polyunsaturated fatty acid and we can increase the public awareness through mass media on diet and physical activity. Now for the cardiovascular diseases and diabetes, counseling and multi-drug therapy for people with a high risk of developing heart attacks and strokes can be done. Treatment of heart attacks with aspirin can also help in preventing the further attacks. Now the cancer, we know that there are different types of cancers, but some cancers can be prevented through vaccination. For example, liver cancer can be prevented through hepatitis B immunization. Also, cervical cancer, it can be prevented through human papilloma virus vaccine. So, a proper vaccination can help in prevention of certain cancers. Also, the screening and treatment of precancerous lesion can also help us in preventing the disease early in its stage. WHO has provided a global action plan for the prevention of non-communicable diseases. The vision of this plan is a world free of the avoidable burden of NCDs, and its goal is to decrease the preventable burden of morbidity, mortality and disability due to NCDs. So it has 9 targets. Out of these 9 targets, one target is that a 25% relative decrease should be brought in overall mortality from CVDs, cancer, diabetes or chronic respiratory diseases. So following the global action plan, Pakistan has developed its own national action plan for the prevention of non-communicable diseases. The common action areas of these preventive strategy are the behavioral change communication, reorientation of health services, monitoring and surveillance, and research. For behavioral change communication, this is a strategy for preventing the non-communicable diseases by changing the behavior of the population, by changing their lifestyle and their dietary habits and their physical activity. So there are certain campaigns can be run and health education sessions can be carried on for the behavioral change communication. These sessions can be carried out in schools, mosques or other places where the community meets. So by through health education and communication on behavior, we can change the lifestyle of the people and which can eventually bring a decrease in non-communicable disease. Further, we can reorient the health services. How we can reorient the health services? By increasing the professional capacity and improving the access to drugs. So there are the non-communicable diseases. Sometimes the medicines is not available. So making the medicine available for the non-communicable diseases is very important to control them. Further, we also need to train our doctors and the healthcare professionals in the control, cure and prevention of the non-communicable diseases. Further, we can do continuous monitoring and surveillance of all the non-communicable diseases, that what is the prevalence of these diseases in Pakistan, what is the incidence, in which areas these diseases are more common, and what are the risk factors associated with these diseases in Pakistan. So we can better know and understand these diseases. Further, there is a need of more and more research so that we can identify the factors which are more prevalent in Pakistan and which are associated with the NCDs. WHO has developed sustainable developmental goals to improve the quality of human life. So it has set certain targets and which it aims to meet by 2030. So let's have a look in these targets and see where we stand. The probability of dying from cardiovascular disease, cancer, diabetes and chronic respiratory diseases between the ages 30 and 70 years, it was almost 24.8% in 2000. So the global target is to decrease this probability of dying to 17%, and Pakistan has set this target to 20%. Similarly, the suicide mortality rate per 100,000 population was 2.6 in 2000. So the global target is to bring this figure to less than 1 and in Pakistan to 1.6. The coverage of prevention and treatment of substance abuse was only 10% in 2015. Now WHO aims to provide coverage of prevention and treatment of substance abuse to more than 80% of the population. However, Pakistan has set its target to 35%. Similarly, WHO wants to bring the decrease in the total alcohol per capita consumption. It was 0.2 in 2015 and Pakistan has set its target to bring it to less than 0.2. Similarly, road traffic mortality rate per 100,000 population was 14.2 in 2015 and the global aim is to reduce this mortality to 8% and in Pakistan to less than 13%. Universal Health Coverage Index was 40% in 2015. However, WHO aims to provide universal health coverage to more than 80% of the population by the year 2030 and Pakistan aims to provide this coverage to at least 65% of the population. Similarly, mortality rate attributed to household and ambient air pollution, it was 88.8 per 100,000 population. However, no targets are set for this so far both by Pakistan and by WHO. The age standardized prevalence of tobacco smoking among persons 15 years and older, it was 36.7% in males in 2015 and the aim of Pakistan is to bring this figure down to 10%. Now there are various challenges to address the non-communicable diseases as the non-communicable diseases are very prevalent but there are certain constraints due to which we are unable to prevent and control the NCDs. Out of these challenges, one is the insufficient resources to meet up with the global outbreak. So many countries, especially the developing countries and the lower middle income countries, they are facing this challenge more than the developed countries because of lack of the resources and the lack of manpower. They are unable to tackle these NCDs. Further, there is lack of commitment by the government and the political parties in different countries. Especially in the developing countries, the government is not that much committed for the prevention of NCDs. And when there is lack of commitment by the government, there is lack of funds, and because of the lack of funds, it becomes difficult to run certain programs to control the NCDs. Further, in Pakistan there is double burden of diseases, that we are having both the communicable diseases and the non-communicable diseases. So because of the double burden of our disease, we need double resources, double manpower, and we need more drugs for the treatment. So because of this double burden of disease, it becomes difficult in Pakistan to control the NCDs. Further, there is also lack of research to develop the customized intervention against the NCDs. So we need to enhance research so that the particular risk factors can be identified and the specific interventions can be developed against them to prevent them from causing NCDs.